Okay, we're going to go ahead and get started this afternoon. I'd like to welcome you for coming to our parent workshop. That is an introduction to Applied Behavior Analysis 101. And our company, Success on the Spectrum, is hosting this parent workshop. And it's intended to provide an overview of ABA and to respond to questions and hopefully be a good reference point and guide. So I'm going to introduce Casey Bradford. He's our clinical director. He's a BCBA. He's been in the field for, Casey, over 10 years. And have him take it from there.
All right. Thanks. Welcome, everybody. So today we're going to be talking about applied behavior analysis. Just a quick little disclaimer here. Any information provided in this workshop is intended as general information. So, for specific recommendations and continued guidance, you want to collaborate with the BCBA through your ABA service provider. Okay. So first thing I wanted to ask is, what do you want to know about ABA? Take a minute to think about what you already know about ABA and what you'd like to learn today. Write down a couple questions you have. So if you want to pause the video, feel free to pause and write down some questions that you might already have. You're welcome to use the notebook here. Any questions you may or may not. Okay, we're going to go ahead and share out now. Valerie.
Well, really, I just want to know how to help my kid that has tantrums. I feel like I'm coming in blind and don't know anything about it, so just kind of open the door.
Okay, that's good. We'll definitely get to that in this presentation, so very good. Ted, anything?
Yeah, I think that, when I talk with parents, a lot of times there's just the question in terms of, sometimes parents are kind of at their wit's end and just kind of go, I don't know what to do next. What can I expect from ABA therapy? And, help me to better understand the framework for what it entails and, how that relates to what I'm currently going through at home.
Okay, yeah. And that's certainly a thing. It is a very difficult challenge to be a parent with a child on the spectrum, and definitely, having a plan in terms of how you're going to address that is, is a good thing to have and to think about as we go through the presentation here. So, all right. Okay. So let's see. So, and that kind of relates to our next slide, which is just about the autism parent. So the burden of stress is great for parents of those with special needs. A recent study found that mothers of adolescents and adults with autism had levels of stress hormones that were comparable to soldiers in combat. If this is the case for you, you definitely want to seek out support. First thing to do is to get a diagnosis. You're definitely going to want to get that, and then contact your insurance provider or the Department of Developmental Disabilities. They would be able to assist you with getting a comprehensive diagnostic evaluation. And then once that's done, that will help in terms of getting supplemental services such as ABA, speech and language therapy, occupational therapy, physical therapy, feeding therapy, and of course the Department of Developmental Disabilities would also have additional resources as well.
I have a question.
Sure.
So is that would my pediatrician be the one that does the diagnosis, or where would I go to get that?
Yeah. If it's a traditional family doctor, probably not, but you would be looking for either a developmental pediatrician, a neurologist, or a psychologist to make that diagnosis. Good question.
Got it. Thanks.
Okay, any other questions so far? Okay. All right, so functions of behavior. So B.F. Skinner was an American psychologist, behaviorist, author, inventor, and social philosopher. He's also considered the first applied behavior analyst. He discovered that all behaviors can be categorized into 4 functions. And the function of that behavior can tell us what the person hopes to gain from exhibiting that behavior. So 4 main functions. We'll take a look at those 4 functions, which are sensory, some also might refer to that as self-stimulatory. Those are both synonymous terms. But the child behaves in a specific way because it feels good to them. Alright, so yeah, escape is the second one. The child behaves in order to get out of doing something that he or she does not want to do. A, attention. The child behaves to get focused attention from people that are around them. T, for tangibles. The child behaves in order to get a preferred item or to participate in an enjoyable activity. Yes?
Is that like when my kid throws a tantrum at the store because he wants a candy bar?
Exactly, yeah, that would fall into that category of tangible, for sure. So let's go a little more in depth with that, and we'll get to that exact scenario here in just a few minutes. But so for self-stimulatory, a person behaves in a specific way because it feels good to them. So sensory behaviors are internally pleasing in some way. This may also be called sensory seeking or automatic reinforcement. Those are all terms that are similar. And they function only to give the person some form of internal sensation that is pleasing, or to remove an internal sensation that is displeasing. Like if I have an itch and I scratch it, right? That would be an example of that. These behaviors occur when the child is alone, and may also occur in the presence of others. So let's look at some examples here. A child might rock back and forth. So the simple act of rocking back and forth feels good. It's enjoyable. And so that might continue to maintain that behavior. A child may drum on tabletops. They may do this because the sounds or the vibrations are enjoyable as well. They may rub their knee to soothe pain after they just banged their knee against something. An adult may drink alcohol because they like the buzz. Or an adult may wear a certain shirt because it is comfortable. Okay. What behaviors have you seen that might fall into the self-stimulatory function? Can you think of any?
Would like clicking a pen?
Absolutely, yep. And what about that would be enjoyable?
Sometimes it's just like to kill the time, or just, I don't know, something to do with my hands.
Yeah, exactly. So just that movement could be a reinforcing in and of itself, for sure. Okay. We'll look at escape. So escape behaviors occur because a person wants to get away from something, and it would be something unpleasant or something they don't like. And this could be due to a lack of motivation, or it could be that the skill is too hard, the task is too challenging, or it could be both of those things. Examples: a child might engage in aggressive behavior so that his teachers stop running academic tasks with him. Or a child might engage in self-injury to avoid having to go outside to play with classmates. Or a child may remove his clothing to avoid being in a public place. An adult may pretend to be sick in order to avoid going to work, and an adult may use a certain route to work to avoid traffic. Those are all examples of escape. Now, it's nice here that they give examples that are connected to adults too. All 4 functions do apply to both children and adults, and all people, all living things, all animals, I guess you'd say. What behaviors have you seen that might fall into that escape function? Yeah.
Well, I think I definitely do some of those things, and it's interesting. And so, I mean, I think your point is that even if you don't have a diagnosis of autism, it's human nature to engage in these types of behaviors, correct?
Yes. Yeah, and what that behavior looks like could be classified as either a desirable behavior or an undesirable behavior. So just based upon the context. So, but yeah, so essentially all 4 of those are going to apply to all of us. Oh, so in terms of escape, can you think of an example of a behavior you've seen, maybe with your kids or with just anybody with regards to escape?
I mean, I didn't like take my medicine when I was a kid, so I would throw it so I didn't have to take it.
Okay, there you go. So that throwing behavior, the function for that would be to escape from having to take the medication. Yeah, exactly. Good. Attention. A child behaves to get focused attention from parents, teachers, siblings, peers, or other people that are around them. It gains some form of social attention or reaction from other people. When we think about that, oftentimes when we think of attention, we think of positive attention. So what's an example of like positive social attention that you might give, or that someone might receive?
Just good job.
Yeah, good job. That's oftentimes that's heard when in classrooms with teachers, with parents saying, hey, great job on this and so on. Yeah.
So sometimes the term is used that someone's a people pleaser, right? And perhaps that's, maybe that's going above and beyond to get positive attention.
Sure. Yeah. So that all those people pleasing behaviors could fit into that attention function. Yeah. For sure. But the thing about attention too is that it might be maintained by attention that doesn't even appear to be that pleasant. So if a caregiver is talking in a stern voice or trying to explain reasons why the child should engage in a more appropriate behavior, or saying stop or don't do that, or asking them why did you do that, those kinds of things, those would all also be considered attention. And the way you can sometimes tell if it's attention is that the child may laugh, they may appear excited, or be looking right at you when the behavior is happening. So those things might be indicators that the behavior is occurring for attention.
Are you saying I shouldn't say stop or don't do that? Like, how am I gonna get them to not do that if I don't tell them to stop?
Yeah, that's a really good question. In ABA, we often try to specify the behavior we want. So rather than saying what not to do, we would tell them what we want them to do. So what's an example of something that you might tell someone to stop for?
I mean, they're, getting into the cupboards when it's not mealtime,
Okay.
we need them to stop so they're not,
Great. So giving them some other instruction that would lead them away from the cabinet would be giving them another instruction, an alternative like, here, walk this way, or come with me, or here, let's go do this, let's go help me with this, or getting them kind of to redirect away without saying stop necessarily. Yeah. So those could be ways that you could redirect that. In some cases, you may just, as long as things were safe, you might just ignore that behavior, as long as there was nothing obviously dangerous in the cabinet. So of course, then you need to address the behavior. Okay, but examples, here's some other examples. A child might whine until their parent attends to them. A child might scream in order to get people to look at them. They might laugh in order to get an adult to laugh with them. They might break a toy in order to be scolded by an inattentive adult. Or they may wear provocative clothing to get attention from other adults. So what other behaviors have you seen that might fall into that attention function?
I think sometimes, kind of going along with example number one, maybe you're in a store and your child is wanting a toy or something like that, and they say no, and you say no, and so maybe you're distracted and you're doing other things. You're really trying to just focus on getting out of the store, but your child is not done with wanting to have you focus on that toy. That they're still very much focused on that. So perhaps they kind of have a fit right there in the middle of the store, and you're looking around, kind of going, oh my gosh, what's happened? The worst possible time, they're doing it right here at the checkout, and I think they kind of know that they've got you at that point, right? That perhaps their behavior is going to get them what they want.
Yeah, and so kind of identifying there, you know, is this a behavior for attention or is it for that thing, that item?
Oh, yeah.
Would be important to distinguish that
Sure.
difference. And sometimes it could be for both. The behavior could be happening for both reasons. So again, you're gonna wanna look for those cues. Are they looking directly at you? Are they pulling on you? Are they looking directly at you? So those could be indicators that it's attention. If they have the object in their hand or they're reaching out for that object, that might be an indicator that it's for tangible function.
Got it.
Okay, tangible. So that goes right into our next one, which is tangible. So some behaviors occur so that the person can obtain a tangible item or gain access to a desired activity. So here's some examples. A child might scream until their parents buy them a new toy. That's similar to what you were saying. A child may cry until a parent brings them to the zoo. A child asks his mother for milk. So notice in this example, that's actually what we would want them to do. We would want them to ask for something. So that happens to be a desirable behavior versus an undesirable. A child pours his own glass of milk. Or an adult goes to work to make money. That is an adult example there. Keep in mind here, money in this case would essentially it would be a tangible there. So that would be fall into that tangible function. Okay, what else have you seen that might fall into that tangible function?
Basically any object, right, that someone wants, they behave a certain way to get it.
Yeah.
Whether positive or negative.
So like with your kids, what are some things maybe that they often want to keep with them, or?
Sure. I mean, it could be a preferred stuffed animal. It could be their blanket. It could be, I guess it could even be that they want candy. And they want candy for breakfast, right? And so me and my wife are trying to encourage, we need to have breakfast first, and nonetheless, candy is the focus.
Yeah, there you go. Those are all great examples. Very good. Yeah. Okay, so a little bit more on functions. So once you understand why a behavior occurs, then you can intervene both before the behavior happens, and you can select appropriate strategies for responding to that behavior if and when the behavior occurs. So, so the question is, how do you know though? So you want to take notes on what happened before the behavior, like just before the behavior, and we call that the antecedent. What the behavior was, what did that behavior look like? What do we call that behavior? And what happened right after, or what we would call the consequence. Now the consequence here does not mean like a punishment or a spanking. Like that's not what we're talking about here. Those would be a type of consequence called a punishment, but that's not what we're looking at here. We're looking at what happens right after, or what doesn't happen right after the behavior. Example 1, if the child is not getting attention because their parent is on the phone, that would be the antecedent. They may whine and cry. Those are the behaviors, whine and cry, resulting in the parent stopping the call and consoling their child. That would be the consequence, what happens right after that behavior. So, question here, what do you think that function would be based on that information?
Maybe attention, because they're getting attention from their parents.
Yep, exactly, yeah. And you can see that both here in the antecedent as well as in the consequence, the consoling itself there becomes that attention that occurs after the behavior. Example 2, if the child is not getting attention because their parent is driving and they are in the back seat, that would be the antecedent. They may whine, cry, and kick the back of the seat. Now, those would be 3 different behaviors that occur in that circumstance, resulting in a parent turning around and scolding their child, such as, "Stop doing that. I told you to stop. Why won't you stop?" Right? those would that would be the consequence. So this what we call ABC pattern can help you to identify that function, so you can move forward with reinforcing desirable behaviors and not reinforcing undesirable behaviors. Any questions? Okay. All right, so talking about rewards versus punishment. A lot of times parents are unsure how to respond, and with ABA, we want to use we want to use the best strategies and the most appropriate strategies for addressing behaviors. So when we look at the research, for example, B.F. Skinner did research on rewards versus punishment. He divided 3 different groups, only gave rewards for good behavior to group 1. Group 2, he only punished for bad behavior, and in group 3, they were given rewards and punishments. What do you think here? What do you think resulted in the best responses?
I would guess group 3, because they know both what they're doing well and what they're doing poorly.
Yeah, that's a good guess. Here he proved that actually rewards are more effective than punishment. So even in this group where there are only good rewards, or only given rewards for good behavior, that group actually outperformed the group that was given rewards and punishments. So that's something to keep in mind, that that we want to keep our methods to include as much reinforcement as we can, and we would avoid using punishment in general, as a general principle. Okay, so Skinner's behavioral experiments proved that rewards are more effective. He discovered that positive reinforcement is the best tool to shape behavior, encourage lifelong learning, and promote high self-esteem. That's really important there, because what we're teaching them is we want to teach them what to do, not what not to do, if that makes sense there. So he suggested that the main thing people learn from being punished is simply how to avoid punishment. So rather than actually learning an appropriate or desirable skill, they're learning just creative ways to avoid punishment. That can come across as maybe they're learning to lie, or to deny, or to run away, or whatever. Could be a variety of different things there. So shaping behavior, as described by B.F. Skinner, functional analysis can be used to modify behavior. You can reduce problem behavior or increase appropriate behavior. So here's ABA in a nutshell. ABA can be used to change the behavior of your children, your parents, your pets, and even your spouse.
Your pet?
Strategies, reinforcement strategies work on your pets as well. That's absolutely correct. So the basic concepts are not that difficult to learn. However, the ability to use them correctly in the correct context does take effort. So first, identify the behavior to be changed. Second, determine the function. And 3, develop an intervention. Okay? So developing that plan. So we want to prevent the likelihood of that behavior occurring again. So we always want to look at what we can do beforehand, or what we can do proactively to anticipate any particular triggers to remove the opportunity to behave improperly. Okay? And we want to replace bad behavior with a socially appropriate behavior. So try to ensure that the old way does not get the person what they want, and you want to reward the new way immediately in as many environments as possible. Okay? So you want to reward good behavior. Immediately and consistently deliver rewards for appropriate behavior, and create opportunities for them to succeed. And then also follow through. You want to continue to gather data to determine if the inappropriate behavior is reducing and the appropriate behavior is increasing. You want to see that, you want to take note of that, take data on that, so that you can really determine if that intervention is being successful. Yes?
So like with that, making sure that the old way doesn't work and the new way does, would that be like if they ask appropriately for a candy bar, give them the candy bar, versus if they're throwing a tantrum and crying and screaming in the store?
Absolutely, yeah. That would be the desirable behavior. And that doesn't mean you have to honor that request every single time. Perhaps in the beginning, when you're teaching appropriate behaviors, you might establish that, okay, if we have a nice calm body at the store, then at the end you can have a candy bar, right? So that might be something that you could implement. In doing that until they get the hang of things. And then you build in opportunities for them to learn that they're not always going to get that thing. So, yes, good one. And then make changes if needed to fine tune that intervention. So you're gonna use that data to really look at and see if there needs to be changes. All right, let's test our knowledge real quick. So let's imagine here there's a child named Julie, and she spits in her hand during group activities, when she is alone, and when she's asked to transition from a preferred activity to something else. So what's the problem behavior? Julie spits. What do you think the function would be here? This one might be a little tricky. I'll give you a hint. This is the key thing. If she's doing the behavior when she's alone.
That's the sensory one, right?
Yes, that's the sensory one, definitely. Yep. So in other words, that spitting behavior is rewarding in and of itself. There's something about either just the action of it, or some kids will even play with their saliva, so that could be reinforcing in it of itself. So that would be sensory, yeah. Okay, and then the intervention. So what could you do? You could replace the spitting with a socially acceptable behavior, such as giving hand sanitizer or lotion or something like that instead of the spit. And then you could praise her when she uses the lotion instead of spitting.
Is there a chance though that lotion just gets used too much too, and then?
Yeah, that is always a possibility. So you have to kind of look at what, how frequently you'd offer that. You'd look at how frequently that behavior is happening. Maybe it doesn't need to be offered every 10 minutes, but maybe the behavior is only happening twice a day, right? So maybe that spitting is only happening twice a day. You would need to give lotion that much. So it really depends on how frequently things are happening and the appropriateness of putting on lotion that frequently or not.
Got it.
Okay. All right, let's take another example. Kevin. Kevin is a nonverbal 4-year-old boy who attends a preschool program, pulls his peers' hair throughout the day. So based on observation, whenever he sits with another child, he pulls the hair of the nearest girl. The teacher then sits near Kevin in order to give him verbal reminders that it's not nice to pull hair. So what's the problem behavior here?
Pulling their hair.
Pulling the hair, yeah, exactly. All right, what would be the function, do you think?
Attention?
Mm-hmm, good. Why do you think that's attention there?
Because when he pulls the hair, then he gets the teacher's reaction and probably the girl whose hair he's pulling.
That's absolutely right, yeah. Even though it doesn't say that there, you can assume that a child whose hair is getting pulled, there's going to be some reaction generally to that, so definitely. Yep, good. Yeah. All right, and then so the intervention here, what could you do? Let's take a look. We could prevent the likelihood by moving him away from the peers in the first place. Maybe having them sit in different areas, or if you're doing groups, just grouping them separately. You could replace the problem behavior with the socially appropriate one by teaching the child to ask and wait. So they could ask the teacher to come over. That would be an appropriate way. And you could praise them when they're acting appropriately. Okay? On the flip side of that, you would withhold attention until they're asking appropriately or stop that inappropriate behavior. So we would actually want that teacher in that circumstance to not give attention when the hair pulling is occurring. Now, I know some of you are thinking, well, you have to stop the child, you have to intervene there. And yes, that's absolutely true. You do need to intervene in that situation. However, when you do that, you want to do that without providing attention. It could be as simple as jumping in front and just gesturing like this, right? So it doesn't have to include attention when you do that. Yeah. All right. Any questions on that? All right. Bobby. So Bobby's a 4-year-old boy with limited verbal skills who drops to the floor and cries when it's time to brush his teeth. Whenever one of his parents is holding his toothbrush and says, "It's time to brush your teeth," he drops to the floor and begins to kick and cry, which results in the parent removing the toothbrush, consoling him until he stops crying and letting him play in his room. Okay, so what's the behavior here, the problem behavior?
The dropping to the floor, kicking, crying.
Yep, all 3 of those, exactly. Yeah. Oh, yeah, I liked your answer better there. It is, yeah, refusing to brush teeth might not be as observable as the dropping to the floor, the kicking and the crying. That's gonna be more objective, that's the behavior that we're talking about. So, I like your answer better. Okay, and then determining the function here. So let's see, what's the antecedent here? What happens first? What happens first?
Ask him to brush his teeth.
Ask him to brush his teeth. So they're placing a demand. They're giving an instruction for him to do something that maybe he doesn't want. So what function would that be?
I might be reading into it too much, but with my kids, it's because they don't want to go to bed. So they're escaping the having to go to bed.
Okay.
And they know that teeth brushing is indicative that it's time to go to bed.
Sure. That could be, especially if going to bed is just not a preferred thing. Sometimes kids, though, in that circumstance, it's possible that if they're like ending TV time in order to go upstairs to brush teeth. Sometimes in that case, it actually might be tangible because you're stopping those fun things and then they're having to go to bed, right? So,
Right.
So that's also a possibility when it comes to that as well. But in this case, if he's being told it's time to brush your teeth, and then the behavior immediately happens, that's going to give us a good indicator that this is what function.
It's the E1.
Yep.
The not wanting to do a task.
Uh-huh.
Escape.
Escape, you got it. Yep, that's right. Now notice here, so that in the antecedent would tell us it's escape. Let's look at that consequence though. Consoling him until he stops and letting him play in his room. So this is now a little bit tricky because what does the consoling him tell you?
Attention.
There's attention, and letting him play in his room. What does that tell you?
Tangible.
Tangible, right? So now you've got a few different variables going on here. So, but if consistently every time that this is said, it's time to brush your teeth, and that's happening, that's going to give us a clue that more than likely it's that escape function. Okay? All right. Okay. And then let's look at that intervention. So what would we do? Let's prevent the likelihood of that tantrum by setting expectations and the promise of a reward. So next time, maybe the next day, you talk with your child and you say, okay, later on tonight, we're going to brush teeth. And when we brush teeth, we're going to get a little more time playing in your room. Okay? So first you can brush your teeth, then you can have some more time playing in your room. Okay? That might be a way of setting that up for success. And then you reinforce starting the task with pleasant attention. So as soon as they start brushing their teeth, you're going to say, wow, that's awesome. You're doing such a great job. And we might teach them if they're showing signs of frustration, or you could teach them, okay, can I stop now? Yep, you did like 15 seconds, you're good. And then you can just build from that point forward. Or you can say, okay, do you want to brush your teeth in 5 minutes or 10 minutes? Right? Give them a choice there and negotiate that start time. That's another intervention you could try beforehand to see if that's helpful. Generally, you do not want to let the child escape from brushing their teeth though. Once that expectation is set and there's a positive reinforcer attached to that, you're not going to want to let them escape. You're going to keep redirecting with minimal discussion. And if there's any hitting or aggression or anything like that, you would just block and just kind of redirect back to that. We're brushing teeth, right? You might just gesture to the toothbrush and just continue to follow through on that. Okay? Yes.
So that sounds great in theory, but there's a lot going on there. Like, how do you actually follow through on all that without
And
getting burnt out by the end of
that's
the
a
day?
really good point. You want to be as patient, you want to portray as much patience and calm as possible. The calmer you are, the calmer your child is likely to pick up on that. So when you're redirecting, even if they're upset, you're calm and you're just pick up the brush, put it in your mouth. Awesome, there you go. So then you're praising those steps as they're engaging and continuing that activity. So as they make movements towards that, you're going to keep praising that and giving that positive attention for those, for the positive behavior of brushing teeth. Okay. It is much easier said than done, but this is the idea here. This is what we want to do. Ultimately, we want, if brushing teeth is part of their routine, we don't want to let them out of it. It needs to be something that happens in some way. Okay. All right. Now, one thing about this one though is if your child is large enough, in the sense they're a bigger child, they can cause harm, or that there might be safety concerns involved, then generally you want to be careful with things like following through, because that could escalate things and make things a little bit unsafe. So basically, if you're going to do some sort of intervention that's following through on something and it's causing intense behaviors, you're going to want to consult with a professional on that, just to make sure things are being done in the best and most ethical way. Okay. All right. Any other questions before we move on? No? Okay, Megan. Megan screams and cries when she gets hungry. She's embarrassed in front of others. Mom immediately gets a snack out of her purse and feeds Megan. Megan immediately stops crying when she gets what she wants. Okay, so what's the problem behavior here?
Kind of throwing a fit, right?
Throwing a fit. So can you tell me a little more specifically, what is that?
Screams and cries.
Screams and cries. Yeah, that's the behavior. Good. All right. Let's take a look at that function.
I mean, she gets the snack from mom.
Uh-huh.
So tangible, right?
Tangible, yeah, that's right. And what could be an intervention here that we could try? What could we do beforehand, before the screaming and crying happens?
We teach Megan to say, I'm hungry, can I have a snack?
Yeah, yeah. We could also feed her before those behaviors occur. So making sure that there's scheduled times and that is happening on a schedule, on a regular schedule, could help to reduce the chance of that happening. You could replace the bad behavior with, like you said, asking and waiting for food, so teaching that skill. You could reinforce appropriate asking by giving her food and praise as well. Okay. All right, question and answer. What behaviors does your child engage in? I want you to think of one example of a behavior that your child engages in, and then I want you to tell me what you think the function is based on what you've observed, and what kind of intervention you might consider using reinforcement strategies as well as antecedent or preventative strategies.
So I'm thinking of my son and daughter,
Sure.
and my daughter is 3 and my son is 5, and she knows that she can she likes to push buttons of her brother, and so she will whether it's taking a toy that he likes, or whether just kind of shoving him and running away. She does various things that she knows can just get a rise out of him, right? So yeah, I guess if we're looking at the different components, so behavior is first, right?
Yeah, but that's a tricky one now because you're talking about two kids now. So now you've got two sets of functions going on. You've got the function that's
Oh.
affecting your son and the function that's affecting your daughter.
Oh,
Now,
okay.
so if you think about that, what would be the function for your son's behavior there? What is he getting out of that?
What is he getting out of that? Well, he when she does that to him, he yells and screams, and mom gets involved and says, "Okay, what are you doing? What are you doing?" And we either need to have timeout, or one needs to apologize to the other, and it seems like it's a recurrence.
Gotcha. And does that usually stop the behavior that was happening beforehand?
For a while it does.
Okay. Right, until the next time they're playing together.
Until another hour goes around, and
Got it.
gets the itch to push buttons again.
Okay. So what do you think the function is for her behavior there?
So she's trying to get attention.
Yes,
I think, right?
yes.
She's trying to get a rise out of him. She knows.
Mm-hmm. Exactly. And whenever you say getting a rise out of someone, generally that's an attention-seeking behavior. So so there's that, and then your son is probably doing what he's doing, the screaming, because of what? He's trying to
get mom's attention, right?
possibly.
Um,
It could be mom's attention. It could also be to stop that behavior from happening.
yeah. So he's trying to escape that from
Yeah,
happening,
could be
right?
escaping from that. Yeah.
Uh-huh.
So what you want to look at is what can you teach both of your kids there? What other alternatives could you teach for maybe possibly for your daughter to get attention in more appropriate ways? And then also teaching your son to come and appropriately let you know, for example, hey, she's bothering you right now, or hey, can you help, I'm getting frustrated, or I'm getting angry, something like that would be kind of more appropriate than the screaming, right?
Mm-hmm.
And then, so that's just a suggestion.
That's good,
Again,
yeah.
It's,
Okay.
just an example, kind of, and by no means am I recommending that you do that.
So what about my daughter though, where she's trying to get a rise out of her brother? What is it? Just that she's not getting enough attention?
That would be my guess. Is that she may need attention at certain times of the day or certain periods, maybe perhaps when mom or dad are busy, kind of coordinating that so that there's periods of time where she's getting a good amount of attention, or alternating it such that maybe she gets 10 minutes of consistent attention, and then okay, I'm gonna go do this now, and then you take 10 minutes away, kind of alternating, and alternating those conditions of when you're giving attention and not.
Got it.
Could help as well. Okay. Did that?
Yeah,
sound
that helps. Yeah, it was a good sort of double duty example there.
Yeah.
So yeah.
Okay. All right. So all right. Did you have an example in mind?
Yes, it's around bedtime. So it's always, they're told it's time for bed. My son will throw a tantrum, which is usually like dropping the floor, screaming, crying. So I'm thinking it's probably escape.
Okay.
He doesn't want to go to bed. So the intervention might be, I don't know, maybe having a schedule where that's always the same time of day. I don't know, maybe I ask him if he wants to get ready for bed in 5 minutes or 10 minutes, or so he has some choice in it.
Great. Those are all very good antecedent strategies. Yes. Good.
But antecedent, so I would also need to follow it up with actually making sure that I follow through and do all of that, right?
Yes, exactly. So you want to make sure if it's to get away from, if your son is engaging in those behaviors to get away from going to bed, then you're going to want to keep prompting that response of going to bed. Continue to follow through on that. Absolutely. But you also want to do something else with your reinforcement too, though. What could you do to reinforce? What is it you would like to see? What would be the best case scenario there?
That if he doesn't throw a tantrum, that there's some prize at the end of it. Like,
Absolutely, yeah. Like,
I don't know, maybe mom reads a book to him before
Okay,
bed, or
yeah.
you know, something. So
yeah, there you go. Yeah, so that's you definitely want to make sure to reinforce that alternative response. So that's good. Yeah, I like it. Okay, and I think I'm going to skip through the rest here because we had some good discussion already. I think we're going to go ahead and wrap up. Any final questions before? Okay. All right. Well, thank you for joining us today, and we appreciate your time.
Thank you, Casey. This presentation is being recorded, and if it prompts any additional questions, please reach out to us. We also do periodic tours of our center as well, so if you're looking to come and see our center in Mesa, we're just off of Alma School and Southern Avenue by the old Fiesta Mall. And similarly, if you're looking at next steps for getting started with ABA therapy, please reach out. As Casey mentioned, the starting point is that diagnosis, and from that point, looking at getting an assessment scheduled, and really kind of determining what the starting point is, what are the goals that we want to work on, and then going from there. But appreciate your attendance today, and hope you found value in it. Thank you.